Hey guys, welcome back to our video series on rotator cuff strains and tendinopathies. In this video, we're going to talk to you about how we diagnose it in our office. Now, if you've seen our videos before, you know that in this office, we take a very thorough history because a thorough history gets us to a diagnosis faster, accurate diagnosis of our patients better, faster, and out living their lives without pain. So what do you know about a patient has a rotator cuff strain and tendinopathy? They're going to have pain at the shoulders, probably going to be in the front, going out to the side of the shoulder. They're going to have pain when raising their arm overhead, and they're going to have pain when they're putting on their clothes or reaching behind themselves. They're probably going to have a job or a hobby that requires them to lift their arms or work overhead. So now that we're going through our history, there are some tests that we can do to diagnose our patient with a shoulder sprain or tendinopathy. So the first one's going to be the Kennedy test. If our patient's going to be seated, we're going to raise their arm up, we're going to bend their elbow, and we're going to bring their arm in slightly. We're going to stabilize their elbow, and then we're just going to push down at their wrist. If they have increased pain in this region, the test is positive for a rotator cuff injury. Our next test is going to be our internal rotation test. So our patient is going to put their arm behind their back, and we're going to stand behind them, stabilize their shoulder, and try to raise the arm a little bit higher. If raising their arm higher increases pain in the shoulder, this is a positive test for a rotator cuff issue. Our next test is going to be the empty can test. So our patient is going to have their arm out, we're going to have their thumb down, and we're going to try to push their arm down as they resist. If they have pain with this motion, this is another positive test for our patient. And lastly, we're going to do our lift-off test. So our patient will spin around. We're going to have them place their hand in their back. We're going to take our hand and ask the patient to push against our hand. If they have increase in pain when they're pushing against our hand, against the resistance, this is another positive test. So now that you know how we diagnose rotator cuff strains and tendons in our office, stay tuned because in our next video, we'll show you how we treat them.